who had PhD from the beginning, and he set up the Department of Physiotherapy, Sports Medicine, and Rehabilitation Center at the famous Nanavati Hospital, which we see all of these days. All the celebrities are admiring the services, facilities of Nanavati during this unprecedented time. He also had the distinction of being a president of Indian Association of Physiotherapists, and currently he's the chairman of Committee on International Affairs. So this is what we have. I present to you Dr. Ali Irani to tell us about how do we stay fit. Over to you, Dr. Ali.
Thank you, Bansal. Thank you for your kind words. Coming back, I will be talking in a simple terms. I'm not going to use a lot of medical terms because my viewers are all going to be from all walk of lives. To start with, let me talk about our hospital is a COVID-19 hospital, which is only admitting. We have come out of all other things. We are only admitting corona patients. So we are seeing corona patients in and out. So, and every day we have a meeting of all the specialists sitting together and trying to find out what more, what is good, what is bad. So I'm coming up with everything, whatever we have thought and gone through it. The biggest question today, a 65 paisa 3-ply mask, 65 paisa it was, has gone to 20 rupees and 25 rupees and all that. I just want to show you all a simple thing. When you all want, a good mask could be made at home. You don't need to buy any expensive mask. And how to test it? What is the real test of a mask? If you go to see, this is a 3-ply mask which is usually used. But if you're using this, for example, put on a lighter, it goes off. It goes off. No good. Unless you wear this mask double. So you have 2 masks. You wear it. Is it really good? Sometimes good, sometimes bad. But a simple mask, this is another N95 where usually are given to the hospital. When I'm blowing, it won't go off. So not going off is a sign it's a good mask. At home, this is a socks. Take a socks. Give a slit here, 2 slits. 2 slits. It becomes a mask. I can't blow the lighter off. See? So this is one of the best masks made from a pair of socks. 1 pair of socks can give you 4 masks. Washable. Now, only thing you have to do it, you have to put a tissue in between. A tissue you can change every day. 1 tissue piece, fold it, and it goes inside the socks. So one of the best masks. So mask is over. Whenever you want to test a mask, it should be when you blow. It should not blow. It should remain on. So your mask should be good. That is how you are going to prevent. Now coming to, I want to assume, let us all think for some time, we are going to get corona. So is there a fear if you are going to get corona? No. Corona is very, very same, very, very close to your viral infection, your cough and cold that you are regularly getting it at least once a year, especially when the climate is changing from winter to summer or summer to winter or during winter. So there is nothing to panic about it. Yes, people who are elderly, their immunity is low. It becomes low. Now, those who are young, if you think your immunity is going to remain good, yes, it is good. But always remember, whenever you're going to have anything sweet, any sugar, for next 3-4 hours, your immunity comes down. So we need to avoid sugar. We need to avoid sweets. But you're having fruits, direct fruits, whatever sweet it is, no problem. So vitamin D3 is proved to be very good. Now, vitamin D3 is going to come in for vegetarians in drumsticks. Senga, we call it. We put it in dal. It is in sambar. in any gravy they put it. So it's going to come through that. And vitamin C. And the best form of vitamin C are oranges. So I have it 2 a day, always in my office. So before I go home, I would be having both amla, avla. These are the things which had vitamin C. So let us now assume, all of us, I'm assuming I come to hospital every day for 8 hours. I'm dealing with a corona patient. So I'm not scared, and I'm 61, right? Many of my staff tell me, you don't go, don't do this. No, fine. I'm immune myself. So how to immune yourself? Very, very important. I take steam twice a day. You can take steam, wow, morning and evening. I keep sipping hot water or tea. This is my tea maker here. That's my black tea. See? So
Dr. Ali, I think you need to unmute your mic once.
oh,
Yeah.
sorry. I just took it away, so my hand must have. Okay, so I hope you all heard every hour having hot water, tea, coffee, something hot. Because we believe that first 4 days, corona is at your throat level. So don't allow it to go below that. So keep hitting it with hot water, twice a day steam. Hit it, kill it there. So if you're going to sip hot water, if you're going to sip tea, coffee, fine. End of the day, night, nothing better than haldi doodh. Old method, grandmothers used to give us a glass of milk or a cup of milk with haldi, turmeric in it. Nothing, no sugar. You can put honey if you want, but no sugar. I said earlier, sugar brings down the immunity. So what is going to increase the immunity is going to be vitamin C. Vitamin D3 will come in your drumsticks. And another test what we do is regularly, at least 2-3 times a day, take a deep breath, hold it. Deep breath, hold it for 10 seconds. If you don't cough, if you don't feel breathless, you are there. You are on the right track, right? So this is a simple test. Of course, when you come to the hospital, when you enter the hospital, we are given a gun. We check the temperature. Right? Yes, that's 92. So it should be below 100, but not necessarily everybody should go and buy a gun. This gun was for the hospital, for our department. So we check our patient before treating them. Then when you enter, if everything has gone well, there's a green band, what we put on the wrist. So all those are moving in the hospital, whether they are ayabais, ward boys, doctors, nurses, patients. If they have a green tag on their wrist, we are sure they were screened. They are safe, right? So in your institute, if you are seeing people coming, going, if they could be screened, nothing like it. But at present, it is 3rd of May, 4th of May, we are going to be at home. So one, I wanted to start with, one, not to worry. It's not a killer's disease. So not to be worried about COVID-19, or we call it corona in a simple way. It's a virus, as we had cough, cold, pneumonia, almost at the same power. But we should not allow it to grow in us. So hot water will kill it, steam will kill it at the throat level. Increase your immunity. Adrak is good, haldi is good. It's going to kill. So have cinnamon, a lot of cinnamon. I use it when I'm having my chai. I sprinkle it over my, I bring it in a small, it's a powder, cinnamon powder, or what we call it, dalchini. Dalchini is very good. So idea was, what we have decided, let's immune yourself. So only not going out is better, because you're not going to buy it or come very easily from outside. So it's going to be from wherever it comes, if your body is immune. Many of us must have got it and forgotten about it. Many of us, because we don't have any proof to say. Maybe even Nitesh Bansal must have got it. I must have got it 2-3 times and got over it. Many of you all must have got it. So there's nothing to panic, right? Only people who are aged, whose immunity is down, who are diabetic, who are having high blood pressure, they are more prone. They are more prone, so there is a danger about them. So till now, I have been talking about nothing to worry. Increase your immunity, fight it out. When you are scared at home, you put grills outside your windows. You put a grill outside your main door so that, suddenly somebody can't come in. Same thing, grill your body. Increase the immunity, you will fight it. Now coming to what else? This was all the precaution and prevention to be taken, assuming we are going to get it. Now, next, yes, it's almost a month we are at home. There are a lot of exercises which you can do at home. One, to burn your calories. Two, increase your vital capacity. See, when we are talking about vital capacity, please understand all Indians have the vital capacity very low. As low as we can say less than 2 liters, right? And especially females, less than 1.5 liters. So I will be demonstrating how we check it on a spirometer. But for your own sake, simplest thing is to take a deep breath. And when you're bringing it out, bring out with a hissing sound. With a hissing sound, I will be demonstrating. But see that you do it in fresh air early morning. Empty it out. Then again take a deep breath. This is one of the way to increase your vital capacity because corona is going to hit our lungs. So better the vital capacity, healthier we are going to be. And I'm going to now go out and show some other exercises on the bed, which you all can do it. Lying on the...
Can I request you to, elaborate, since our audience comes from a variety range of domain, their expertise, their knowledge may not be exactly for a healthcare. Can I request you if you can just brief us a little bit about what exactly fitness means for all of us who are not into healthcare or not into sports or are not an athlete or a competitor? What fitness should mean for all of us here?
So in simple words, if I have to say, for us, our fitness level is going to be at a level of increasing our immunity to fight corona or any other viral coming tomorrow also. Something else may come up. So a good vital capacity, the base for Indians are, I'm saying a lung can take 4.5 liters of air. Up to 5 liters of air our lungs can take. So when we take a deep breath, so air goes to the base of the lungs. So the impure blood circulates all around our body and comes to the base of the lungs, only to get oxygen to become pure. So as we take a deep breath, so air hits the lung, the oxygen, which is only 20%. 20% of the air is oxygen. They say 20.78%. So less than 21% is oxygen if you have fresh air. So the early morning airs are really good, no pollution yet. Nowadays, the whole day is without pollution. So when it hits the base of the lung, the blood that has come impure, as soon as they receive the oxygen, they become pure. They go to the heart and heart pumps it all over the body. So now our lung capacity, if it is 1 liter, it will take less oxygen. And if you increase the lung capacity to 4 liters, 4.5 liters, when you take a deep breath, you have taken 4.5 liters of air. So the oxygen taken by the blood will be more. And once the blood is oxygenated, it's purer blood. And there is no replacement for it. Blood cannot get oxygen through fruits, cannot get oxygen through chocolates, through salad, through better food, veg food, non-veg food. No. Oxygen has to enter blood only by breathing. Until today, thank God, government has not put any tax on breathing. We don't pay tax on breathing. That's why we are careless about it. We don't breathe properly. So any yoga institute, any yoga that you follow where shows you good breathing exercises, it can be followed. The simplest home method I showed you all, early morning, open your window, take a deep breath through your nose. And when you're bringing it out, come out with a hissing sound, slow. It should come out between your teeth. A sound coming out slowly. Don't be in a hurry to bring it out. No. Very slowly, so oxygen remains, air remains more in your lungs, and the oxygen is taken by the impure blood. Blood becomes pure, goes to the heart, pumps it all over your body again. So morning, evening, whenever you see fresh air, if you can do 8 to 10 deep breathing, you will feel great. As far as replacement is not there, you cannot get good oxygen by eating better or sleeping better or having different type of fruits or having chocolates. No, it has to come. Only way it will come through your body is going to be through air, good oxygen. And from the air, good air, only 20% is oxygen. Rest
So
is
what I
nitrogen and other things.
Right. So what I understood right now, and just to repeat for the clarity of audience, we have different parameters now of fitness because of these times of COVID. Right now, we are talking about fitness in terms of our vital capacity for our how much air we can breathe in. And I think for our viewers, all of us, it's very important to realize the importance of able to breathe as much as oxygen possible or as much as of air possible into our lung. And for that, we need to really practice this breathing exercises what Dr. Ali said. Thank you so much, sir. Let's move on next. I have another interesting question, sir. This is my personal opinion, and I'm sure all the audience here would love to hear. Can you tell us something about your journey with Indian cricket team during 90s? I think that was the most interesting phase of Indian cricket. We got color TVs at our home. Indian team won World Cup in 1983 and 87. You joined them. We could see all those young boys, running around all over the field. And we used to always, especially people of my age who became physiotherapists looking at you because we only knew that time physiotherapy is Dr. Ali Irani running field whenever there is a problem in the place. Could you tell something about your experience and how do you train these cricketers when you were physiotherapists for Indian cricket team? Tendulkar, Kapil Dev, Navjot Singh Sidhu, Ravi Shastri, all these people.
Nitish, I was a physiotherapist after doing my graduation. I was a physiotherapist at Bombay Hospital, Mumbai. And I was doing research. And maximum of my patients that time was sports people, not cricketers, everything, football, hockey. I had Hanuman Singh, who was the chairman of a cricket selection committee. He was coming for his shoulder and knee. I had a lot of athletes coming. So my research was basically on sports people. And there where I met Hanuman Singh, and he's told me that you are in a wrong profession. Why don't you join Indian cricket team? And we need you. There is no physiotherapist. So I was almost the first physiotherapist. There were a big interview level for 1987. Reliance World Cup was there. So they had called a lot of doctors who could help the team. And I was one of them. And then they selected 25. From 25, we was brought down to 4. From 4 again, we were brought down to 2, and the 2 were Dr. Anand Joshi and myself. And then from 2, only one of us could go. So that's how it came on me. But I feel in 87, if I wouldn't have been justified what was required by a sports team, a physiotherapist wouldn't have found a place in Indian sports. And I'm so happy now.
A lot of my generation physiotherapists has become physiotherapists looking at you. So I think that's a very important fact. Yeah.
So I'm always really grateful that being with Dr. Rambai always.
So that's a wonderful journey what we had actually, and we've seen Dr. Ali Rani going upwards and winning the cricket team. Yeah, sir, please.
Sorry.
No worries. We understand that you are in the hospital, you are on duty right now.
Yeah.
And Nanavati itself is a COVID hospital, so we can understand. Please, sir.
Sorry. Yeah. So what was that I had, what I saw in the team that time was there is nothing like warming up. The base of when you start a car, you raise the car, so it gets a little heated. We have a habit, whether it's a two-wheeler also, we raise it a little. So that is what our body wants. When you want to do some activity, you have to warm it up first. So usually I saw the batsmen going and knocking and bowlers coming and bowling at a wall. That was warm up. So first thing when I picked up my idea was, and my theme was prevention is better than cure. So I wanted to prevent all the injuries. By that time, I had done all the studies, the different players, how they went out because of injuries. So when we were taken to the Udaipur camp, which was called as a WIN camp, 1987, I took my first talk to all the players, giving them example of a car being raised, scooter being raised. We need to warm up. So we will have a session of warming up. We will stretch, then a stretching of, initially I had to start my stretching just with 10-15 minutes. But then I went on telling him the importance of it. And then we went on to almost 45 minutes of stretching before starting the game or playing or practicing. That brought our lot of injuries down, and everybody felt they were doing better. Everybody felt. Then It was way back in 1990 that I came up with a test, which was, we were calling it a fitness test for cricketers. We used to make them wear their pads, shoes, gloves, helmet, and a bat, and make them run between the wicket, because the distance between the wicket is going to remain the same. So in 1 minute, how many runs they could take, that was important. So that we established by 1992. We had come into it, we could run, and we had players which were taking as low as 12 runs, and we had players which could take 16 runs. So we got the parameter. No doubt, height made a difference, speed made the difference. I don't want to name any of them, but yes, we had 12 runs a minute and we had 16 runs a minute. And that became very easy. So they themselves could do their fitness test and come whenever they felt they were fit. They had to run. They knew they would be made to run. And it was one of the good parameters for us how to do it. Not technically. The coach knew whether they were batting well or bowling well. As far as the physical fitness was concerned, it became very easy then.
So Dr. Ali, correct me if I'm wrong. So that means you have gave India 4 runs a minute after training them?
Yes, yes. Why sixers? Sixers before 87, there were very less sixers. I had to work on the shoulder muscles, so every time they hit, it was outside the ground. The players used to get scared to hit a 6 because they were caught at the boundary line. So when I said I strengthen your shoulder muscle, so the ball will go out, don't worry. That's why most of the ball went into spectators. So now was an increased strength.
Great, sir. So now we understand how much practice or warm-up actually is required to come up to a, when we have to come to our optimal strength to fight, whether it's a game, sports, or a disease or anything. I think you rightly said there is a huge importance of warming up and exercises or preparing your body before we move it. So that's coming back to our topic, sir. Would you like to show some of our viewers our activities, what all we can do it at home, to keep our body up to this fitness level to avoid anything like what it can be hit by corona for us?
Sure. I'll just take you out now. So you'll have seen my teapot, tea going on. And see, I want to tell people it's very important for magnesium to be in your body. So there was a new medicine developed, vitamin D3 with magnesium. Magnesium, if you remember, I was told in Hindus, they were having chana or groundnut on Friday. Some people have it on Thursday. I don't know about Delhi. Now, under the religious heading, this were taken. Punjab, they said they used to have chana every day. Right? I met a Punjabi friend, he said we had to have chana. I'm talking about the chana kurmura, what we get it at the vendors. They have magnesium. So it is something like that I want to explain. Unless your body doesn't have good magnesium, you cannot store vitamin C or vitamin D or vitamin B12. And there are also these oils available, magnesium oil. We spray it on our patient, those who have pain. It makes a lot of difference. Even that is available on Amazon, magnesium oil. But I feel the best form of getting magnesium, you can have just chana and magnesium comes in. Fine. Are we there? Okay. We are at home. Right? We are going to be at home for long. So my one base. Nitesh, you will guide me. Am I seen and audible? Am I seen and audible? I can't hear you. Nitesh.
Please, sir, unmute yourself.
Oh God. No, I'm unmute. Can you hear me now?
Yes, we can hear you, sir.
Okay. So I'm just trying am I visible?
I think, sir, now since you're in treatment area, there might be some internet issue.
No, no. It's there. My internet is there.
Yes, sir. It's better now. We can see you and hear you loudly.
Okay. So just to explain you all, because we are home whole day, you see this pillow, right? If this pillow is kept under your chest, you can be on your elbow or you can leave the elbow. You can be on laptop You can be on mobile phone. You can read a book. You can read a newspaper, whatever you have. This should be at least 30 minutes morning and 30 minutes before you sleep. So this is one of the finest position. It does multiple things. One, it gives a positioning to your lung for better air intake, right? And you are reading the posture. Whole day you are bending forward, whole day. Even sleeping, you are sleeping sideways, right? So this is the posture to unwind, right? I'll show you on the model also, on a spine model. This is one of the best posture, and when you are there, you can do your reading, you can play with your mobile. It's very important, right? Any question on this lying down position? Am I audible and visible? Am I audible and visible?
Yes, sir, you are audible and visible, right?
Okay.
Pretty much.
Now this is a spine. So what happens whole day? This is the posture. We get up in the morning, we brush, we are bending forward. Then we are cooking, we're bending forward. We are making tea, we bend forward. We are working on the table, bending forward. We are typing, we are bending forward. Right? Again, we are driving, we are bending forward. So whole day your spine is bending forward in this position. And night we cuddle and sleep on one side, on our right or left side. So again, so we need to unwind. So this position that I showed you, that unwinds our spine. So that's why lying down with a pillow under your chest in a prone position, right, is one of the best exercises to unwind. You will feel much better, and it takes care of the neck pain and back pain both, because the unwinding and extension gets the disc back. It doesn't come out that much to irritate at the nerve level. So it's one of the best position is extension, right? And can I have the spiro? I was showing you all about the lungs. So what I showed you all, taking a deep breath, bring out, but this is the another way to see it through spirometer, right? See? And this is for 2.5 liters. So both the things, this is 2.5 liters, but we have a spiro of 5 liters also. We have a spiro for 4 liters also, depending. But most of the Indians cannot do this. If I'll bring it closer to you, both the markers should go up. That means your vital capacity is 2.5 liters, right? You can practice it, but the best way to do it at home is take a deep breath. Breathe out slowly with a hissing sound. You can do 8 to 10 every morning and evening, whenever you find fresh air. Lying down was one of the positions. Now, when you are sitting at home, you're watching a television. Just, I was talking about steam to you, so we have a small unit of steam like this. You see? So, stick it on. I hope it's visible, right? You can take it through your nose, remove it through your mouth, or take air, steam through your mouth, and you can remove it through your nose. So that clears the passage that is required. It goes to the lungs. The steam goes to the lungs. So taking steam to the lung at least twice a day, or just take a hot water and put a towel over it, and the steam that comes, you can breathe in. And or if you have a cooker at home, you can put water in the cooker, let it boil. So when the cooker goes on, where the place of whistle is there, remove the whistle. From the place of whistle, the steam will come out. You can put a pipe also and then take the pipe anywhere and take steam on yourself. There are multiple ways you can do steam. Now coming back to other activities that you can do if you have a band at home, simple band. So when you're watching television, you're talking to your friends, there are so many exercises you could be doing it with the band. Right, so I don't want to go to what, so whichever activity, whichever action you are doing, you keep doing from back also, right? Whichever action you'll be doing with band, each action can be done 8 to 10 times. It will be strengthening your muscle. You can put it down and you can bend your elbow, right? You can work on your shoulders. Again, the elbow. You can do it the reverse, right? Holding it back. See? Number of exercises just with the band you will be able to do. Now in lying down position, there will be a few exercises which I want to do where it will help your lower extremities. Right? I'll just try to position a model here. Come here.
Dr. Ali, correct me. Did I see the photograph for the World Cup what Indian team win just now?
This was it's in the clinic. This is where Kapil made his world record in
that celebration.
So you could be seeing Navjot Singh, Sidhu, Vadekar, and Sachin. It's Kapil Dev, Azhar, and Sachin next to him. Praveen Ambre, Sidhu, and Nayan Mongia behind Rajesh Chavan, Venkatpati Raju, and then is me. This was in Ahmedabad after Kapil made a world record. And I think so that would be a picture of Hero Cup, winning the Hero Cup.
Great.
And this was again our first tour to South Africa.
Oh my God.
First time, India was the first country to go to South Africa.
Okay.
So we have lovely pictures around if your people are so keen. That was Nelson Mandela. Right? We were the first country to go to South Africa after the apartheid was removed. So for lower extremity, I would like people to do this exercise. It's called aerobics. Don't touch on, I don't want them to touch the floor. But they would be doing it non-stop. You can do from 10 to 50. Okay, get a towel. Getting it? So you can do from 10. You can start non-stop. Don't keep it on the once it goes down. You know the muscle goes away. So non-stop, you should take it without touching on the floor. See, it comes down. It waits a little left. You should take it away. Right. So you can do 10 each up to 50 each. That strengthens your quadriceps, keeps going. And for the lower extremity, that is one of the best exercises. Squatting, you can sit and get up on a stool or fully going up to the ground. I just wanted to show you one of our studies about hamstrings. Most of the people have a tight hamstring. So,
Dr. Ali, just for the people who are not very familiar with this terminology, hamstrings are the muscles which are in the leg. Maybe if we can explain a little bit about the anatomy and what kind of a muscle we are talking about. The muscles at the back of thigh, these are the muscle what Dr. Ali is right now talking about.
See, all sportsmen have it tight. And earlier when I was with the team, it should take me 15 to 20 minutes each leg I used to stretch. Each hamstring muscle required for fast bowlers to stretch till coming out. And now with my research work, I found out you can stretch the same muscle and both of them together in 2 minutes. 1 minute. So, yeah. If you see this in my hand, they are marbles. I have played with it, but I don't know whether the new generation has played with the marble. So because we have not played with marble, I still want the marble to be there, but I use it as a tool for treatment. So, yeah. So now you will see her demonstrating, my staff demonstrating bending forward. So the hamstring comes in action. We'll see how much she can go. Is it visible? Is it visible?
Yes, sir. Very clear. Very clearly, sir. We can see that.
You cannot touch down fully. So if you see the distance left, so I ask her to come back, right? So I'm going to place the marble. I'm going to place the marble under her leg. Put it. She's going to stand there for a minute. This is how she's going to stand. Right? And the marbles are there.
Dr. Lee, you mean you have kept the marble under her feet?
That's all for a minute. So where it is kept, it's there. Center. So there is a fascia there. When you stimulate it with your fingers, with a pen, do it for 1 minute. So rather than that, I keep a marble under their feet, under the valgus, right? And that fascia gets stimulated. So we will be timing it as it becomes 1 minute. It's almost half a minute now. For another 30 seconds, maybe we'll see that fascia getting stimulated. The first 20-30 seconds are very painful. Your body weight is on the marble, right? Why I've kept a towel? Because the marble will slip from the floor. So we cannot keep it directly on the ground. So we keep a cloth piece or a towel so that the marble does not slip from there. So usually within a minute, we will see the difference in her hamstring muscle. Right? And all of you can try it if you have got just take a marble at home and put, or those who are attached with sports, or those who go for a walk or do any sports, they feel the hamstrings are tight. They can always find it very, a lot of difference. So before you get out of the house or before you wear your shoes, you can stand on the marble for a minute and then you realize the difference. So it's almost another 10 seconds left and I'm going to, we're going to check. Hey, Leo, are you in Saudi? I think so. I saw Leo.
Yeah,
Okay.
yes, sir.
Yes, Leo, nice seeing you. Okay,
Thank you, sir. Thank you.
She gets off. That's a marble in her hand. She gives away the marble, and we are going to test the hamstring again. You see the difference? Yeah, Nitesh Bansal, am I clear?
Yes, sir. I think the difference is clearly visible. She is could go beyond now.
Yes. So it's almost, you could say we can achieve 4 to 6. So what I was doing it, and it took me 15 to 20 minutes each hamstrings to be stretched. And now it has become every player should carry their own marbles, and before getting down to the bus, before going to the ground or on the ground, while they're having a cup of tea, they can stand on the marble and do some activities, and that's how hamstring becomes loose and better. And doing it every day, definitely it makes it much easier. Now, just a thing for the sportsmen, those who are into sports, usually we play the game every day, but try to give 1 day full rest to your body. One rest is very, very important. 1 day rest to your body, which our Indian players, whichever game they're not doing, that 1 day they use is for shooting of advertisements or socializing or going out or traveling. So that 1 day rest becomes very, very important. Any other demonstration? Can I get back to, you all have any queries?
Sir, I think if we look at now, a lot of us are working from home, which means we are spending a lot of time on our system, desktop, laptops, even on televisions and electronic gadgets. Do you recommend something for our eyes, for our neck, for our back? Because we are spending, all of us are spending huge amount of time.
The exercise I showed you with the pillow under your chest, it aligns the whole spine. We give this to our neck patient, and we give it also to our back patient. It aligns the spine. Just for the neck, the next exercise could be taking a towel, roll it, keep it behind your neck, hold it in front, and push it back. So this is the movement.
Okay.
We call it chin tuck. With a towel, we are strengthening the paraspinal muscle of the neck, and the results are fantastic. If you do this 8 to 10 in the morning with a towel and before you sleep, I'm sure you will not complain of neck problems.
We have a lot of people now coming up with questions, like we have a lot of budding physiotherapists on this forum, sir, who are asking about scope of physiotherapy, about NEET and how they can excel in their life, which I'm sure we'll have to take a separate session with you exclusively for physiotherapy, budding physiotherapy student, which I'm sure we would like you to.
I think so for budding physiotherapists, I can only say there's nothing to worry. We'll be the best profession in the world soon. And in Hindi, if I have to say, I remember that was my theme in life. खुदी को कर इतना बुलंद के खुदा खुद तुझसे पूछे बता बंदे तेरी रजा क्या है. So raise your standard to an extent. Even God should ask you, what do you want from me? I started my career with 600 rupees a month, Nitish. I started my physiotherapy career with 600 rupees a month, my lowest pay. And my highest pay was 1,75,000 per day, per 1 day match that I went for Indian team. They used to pay me 1,75,000.
So I think that assures all of us as a physiotherapist that we all have a bright future. So we have a lot of questions from our viewer who want to ask about shoulder exercise, how we can strengthen our shoulder while we stay at home.
Showed you so many band exercises. Any movement you want to do with the band, you can keep doing it.
So any replacement for band? Like I presume few of us might not have band at home. Can we use something else? I'm sure these bands are available on Amazon.
In 85, 86, there were no bands. I used to make used gloves, the gloves which the surgeons threw. I used to wash them and make rings out of it. And with that, we used to do exercises. I think so. I still have it. If my staff have it, I'll be able to show you. I used to use used gloves as bands. Then band came later on.
Okay.
So you can do free hand exercises for shoulder. 1 second, if I can just. We have this thing gloves. Just come here and show me this. Come here and show me.
Those white surgical gloves.
Can you see me? Can you see this is the wall?
Right.
Right? You can push the wall.
Great.
Yeah. Yeah.
Right. So this will help us to strengthen our shoulder muscles.
No, I want the rings. There must for we do it for this patient here, the rings. So this was I used to make rings out of it and use it for the exercise. Keep tying the used gloves so it becomes one band to do exercise. So bands have come now and so many companies make it. See this, see the lot, all colors, different strength.
Right. And I think all of them are available on Amazon. Once this lockdown is over, we can all try.
No, the earlier ones, what physiotherapists used to use was this to tie up for, SSF under pressure. These rolls were available. Rubber rolls were available.
But now, Dr. Ali, we must also warn our viewers not to use the fresh gloves. We can only use the disposable one. I mean, because right now the whole country is struggling with protective gears for the doctors. So we must just try to buy a glove and start using it for it. So maybe if we have some used gloves, surgical gloves, that we can use it for that.
Yes.
Great, sir. I have another.
Yeah.
Please, sir. We have a lot of kids now at home and they have nothing to do. So we see them, spending a lot of time in front of television, in terms of gadgets, in front of mobile, in terms of, in front of laptop. So can we suggest some activities?
I have two suggestions to the parents. Very soon a physio ball, your kid cannot play on computer or laptop. They are allowed only they sit on the ball. I want to show you that. Very important. And the other one is the position that I showed you, lying down on your stomach. So we have a lot of physio ball.
So the video is breaking in between, I guess. Alita, your video is
fine. I'm away from the Wi-Fi.
So I think your video is. Now we can see you and hear you probably. Yeah.
On a physio ball. Making them sit on a physio ball is going to strengthen the core muscle. And you see the rings I've made from the gloves. Gloves. You can even cut the one for the fingers. and make exercises for the fingers.
Right.
Questions?
No, I think this has a lot of learning for us. At our university, Rishihood University, which is coming up in Sonipat, we have a lot of emphasis on health and wellness. Like, we are not a pure conventional teaching university where we concentrate on whiteboard, blackboard, or a PowerPoint. We put a lot of emphasis on health and wellness per se. So all these exercise, all these information, what you're sharing with us right now, we are trying to implement in our day-to-day behavior while we are on campus, be it a place to study or a place to work for faculty members or a non-teaching staff. So we are going to adopt a lot of these learning what we are going to have from your session today. Not only these time where we are stay at home, but also when we go out and we start working. We had a lovely session yesterday where we talked about spirituality. How do we know our inner self? So we have to clearly distinguish between the religion and spirituality, which we're trying to do at Rishihood. Playing a lot of emphasis. We are trying to have specialized courses where we talk about wellness. We are going to teach first aid, emergency response, psychology, how do we know mental health and everything, well-being, what importance it is for day-to-day life. So we are going to emphasize a lot on this, our curriculum. So coming back to that, a lot of us who actually go to gym are not able to step out of the home right now. And they are feeling bad about it. Gym lovers, I know how bad it is for them to stay without going to the gym. Do you have some advice for them as well?
Free hand exercises, pushing the wall, doing dips, a lot of activities they can do. See, idea is not to get the weight. I don't know whether you'll have tried, just raising your arm on the side and holding it at a fixed place. You won't be able to hold it for more than a minute. That is strengthening. Right? Keeping it straight, your hand straight at a fixed position. Bending your knee, semi-bending of knee. Just bend your knee and try to be in that position. You will see your quads working. Sorry, I'm seeing a lot of questions coming here because I feel this session was more to do with Corona. So from Corona, we have gone to sports and a lot of other major muscles. I can read some of the questions that is coming.
I know, sir. We have specialized question on varicose vein. There are people who are asking about mental health.
I know.
People asking about reorganizing themselves. So maybe
I advise my patient to incline the bed towards the leg. So I always tell them keep a brick under the where your bed is the leg. That's one. Do a lot of static exercises which you can do at the ankle and knee level. SLR exercises. It helps for the varicose vein. And of course, wearing the varicose socks when you are standing a lot. If you remember the old days, the policemen had to wear a socks-like thing which was only for varicose vein. Long standing. Any profession having long standing.
Right.
Hamstring tightness, I've just shown the exercise. That is the best. You don't need to stimulate the muscle to help.
We have another one asking about tennis elbow. I don't know. Shall we start the concept?
Okay. I will tell the reason of tennis elbow. Old days, our elbows are bent. Even when you are walking, it is flexed to 5 degrees when you are walking. So we never do extension. So Surya Namaskar was brought every day. When you do Surya Namaskar, it's going to be plantar fasciitis. The reason could be lack of magnesium. We give magnesium to our patient and it helps them. Their plantar fasciitis pain goes away. So important is it should be a separate lecture where what are the body composition we require to have a healthy life. A lot to do with magnesium, lot to do with vitamin D3, B12. We are avoiding, ignoring.
We have a question on plantar fasciitis now coming up.
I just said, I give magnesium. I add magnesium to my patient. Fantastic result. I can just spray. I spray magnesium after whatever regular treatment we give. It makes a lot of difference. So when we are testing our blood levels, it's not there. Please check your vitamin D3. Please check your vitamin B12. And please check your magnesium. I believe more than 60% of the Indians have deficiency in all of them, or at least in 2 of them. I've tested 8 football teams. 8 football teams had deficiency of vitamin D3 and B12. So if you want to say that through sun we are going to get vitamin D3, it is false. It is wrong. They play 4 to 5 hours every day in sun and they have deficiency of D3. And when you increase the D3, immediately the vital capacity also increases.
So we have a very interesting question now, which says that what kind of exercise we can have which can boost our immunity during this unprecedented
Do it
COVID.
vital capacity. Check. Tell me your vital capacity and I'll tell you your immunity of your body.
Great, sir. We have a lot of questions on our email coming up, sir, but they're all a specific condition. I don't know, can we, there are people who are asking about hip muscle pain. They're talking about chronic mild slip disc. But I personally believe that we will have to conduct a separate session for all these kind of advices.
Just to inform those who are not there, my hospital is a Corona COVID-19 hospital and we have got 85 patients. So I just broken up. You saw me also coming late. I was running from the ward to reach my room to get. I just told them, give me 45 minutes, I'll come back. Supplement for magnesium is chana, a regular chana. What we get is that chana, kurmura, groundnuts. So that chana and,
that's a good resource, sir. So there is a very specific and very important questions we have, right? One question we have where people talk about there are people who are disabled with disability like stroke.
I showed the best posture. I showed extension exercise for posture.
So this is
posture. Half an hour morning, evening. I said a pillow under your chest, lying down position. I showed. Those who have come late, you all have missed a lot of the exercises I had shown.
And so this is regarding people who have stroke or a fracture who are at home. How do they maintain their functional status? That is for them. So I think you have seen, you've shown already a lot of free exercise which can be used by people, whichever body part they would like to wish to move something, they can use that exercise as well.
My other thing is don't sit for long, at least once an hour. Don't sit at one place and order tea, coffee. So whenever you want something, go and get it. That's the best way. So don't sit for long. 45 minutes, 1 hour, get up, go, have a cup of tea, coffee, come back. Don't order it where you are sitting. So your stiffness will go away.
But I think people who have missed the session in the beginning, they can always go back to our Facebook page. The whole session is live on Facebook page. They can go and watch it as many as time they want and they can benefit from that. So another aspect which I want to touch here is, do you see any synergy between food, eating, physical fitness and mental wellness? Are they connected? Are there any synergy? If yes, how can we, improve this synergy and, to the benefit as a behavior as a human being?
I always say that a fit body is a fit mind. So unless, a person may be super duper intelligent, but if he's physically not fit, he cannot put it into it. He cannot sit somewhere and keep doing it. You have to take the course, especially for a physiotherapist. I always advise them, don't take elevators, don't take lift, walk up the steps. So it makes a lot of difference because the calories burning also is maximum when it is you're climbing steps. A good vital capacity, a good strength. I will in simple word, check your height in centimeters minus by 100. That should be your weight. If you're 170 centimeters minus 170 should be your weight. If you're 150, 155 centimeters, 50, 55 should be your weight. The formula we have derived is very simple. Height in centimeters minus 100. Females who want to look better, minus 105. You want them to look better.
We have a very interesting question. So she seems to be a marathon runner. She's a 40 plus female who has been training for being a marathon runner for 6 months now. Do you think it's a good thing to do it and try this out at this age, being a female of 40 plus? I think she's talking about bone density and all kind of stuff. Is it advisable right now to go for a training to run for 1.5 hours a day?
She won't be allowed where she wants to run unless she's running in her own society. But I would ask her to work on her vitamin D3, B12, magnesium, put all the parameters in place. Deep breathing, vital capacity of a marathon runner is 4.5 liters. So she can check her vital capacity, increase her vital capacity. Nitesh, I feel in future the best exercise is going to come out is going to be swimming. I have never had a swimmer as my patient because Bombay has got 2 top, Otters Club, Kharjim Khana, 2 top swimming pools. And many people, many parents send their children there for swimming. And I have never treated a swimmer, a pure swimmer. A swimmer may go to gym and get injured. A pure swimmer, only swimmer who's swimming every day 45 minutes, 1 hour, I will never, no neck problem, no shoulder problem, no knee problem, no ankle problem, no back problem, nothing, no blood pressure, no diabetes. So I feel there shouldn't be any building coming up now onwards. which doesn't have a swimming pool. Whether the swimming pool is on the terrace or whether it is in the basement or whether it is the mid-floor. So swimming is one of the best exercise.
So tomorrow's Man Ki Baat, I think this is a very good suggestion for our
Where you
government.
go wrong, after swimming you are hungry, you go and eat. But my saying is, after swimming for 1 hour, don't have anything other than hot water or green tea or black tea. No sugar, no eating after swimming. So the reserve fat in your body burns. The fat burns because body requires carbohydrate. Doesn't have it after 1 hour of swimming, so it takes it from the fat. So your fat burns. One of the best. You will remain healthy. You will remain fit. Your body weight is going to be perfect.
There are a lot of people who are asking about what should be our lifestyle post COVID-19, post lockdown is over. So I think this.
Mr. Bansal,
I say I want to get corona.
this is
I
General
want
Corona
to
here.
be COVID,
Can I ask you a question?
positive. If corona can fight my body, I'm working. I want to be immune. I'm not going to allow it to come near. Let's have that mission. Let's have that mission. Raising your immunity to a level so that it doesn't attack you.
Right. I think we had a very interesting session since I'm poured with questions and all, but I'm sure with your busy schedule, and I thank you for taking out time from.
Can I ask a question? This is General Corona here. May I ask a question?
Yes, sir. We are proud of you, General.
Dr. Ali, thank you very much indeed. I've just got a question related to Corona. We are getting very conflicting advice on the temperature of the air conditioner to be kept. Somebody says don't keep it lower than 24. Somebody says keep it between 24 and 30 during this Corona period. What's your advice?
Sir, I'm on 20 degree at home and department both. It's not your temperature. It has to do with your immunity. Please increase the immunity. We were told that after 25 degree, Corona will die. We have touched 40 degrees. And we are the most. Maharashtra is at 40 degrees. And we have the maximum Corona. So I'm not going to be believing it so much.
So we can keep it below 24. There's no harm in that.
You should have a comfortable. If your body is not comfortable, you are going to be in 24, not sleep whole night. So immunity has gone down.
Thank you. Thank you very much, Dr. Hani. I think you've given us a tremendous exposition this morning. Thank you so much.
We are proud of you.
Thank you, Mr. Bansal. Thank you.
Thank you, General Sahab. As Dr. Ali said, we all are proud of our defense forces. So I think the best message what we have got from Dr. Ali today, more than external factors, we need to concentrate on our immunity itself. Everything what we do, drink, eat has to be towards improving our immunity. Maybe as he said in the beginning, 2 oranges a day, dalchini, and then exercises. Yes, of course. So I think, Dr. Ali, I must thank you on the behalf of whole. Yeah, of course. So on behalf of complete. The black coffee, yes.
Black tea, tea is better. Black tea.
Black tea it is, sorry.
I put lime in my black tea. I put lime on limbu is again vitamin C.
Right. So everything which gives us vitamin C, it's considered as best. So Dr. Ali, lovely.
I said drumsticks. Have drumstick in your dal, gravy, whatever you make. Drumstick.
Ali, it was always wonderful and a pleasure hearing you, listening to you and talking to you about how all can improve our health. Thank you so much on behalf of complete Rishihood family. We thank you for your session and your time. I know how busy it is right now for you, being in a COVID hospital, taking care of patients. We thank you on behalf of the whole humankind. Please keep your good work doing. I'm sure we will connect again. And from Rishihood family, we once again wish you all the best and look forward for you for any kind of help we can provide. We can associate with your cause. We would also like you to be associated with us, and I'm sure we'll keep doing this kind of a work and take this journey forward of keeping everybody healthy and well in future. So once again, everyone.
Thank you. I saw a lot of thank you messages from Ajay, Kumar, Leo, all of you, Shruti, Mona. Thanks a lot. God bless you, and thank you to Rishihood University to have such a good session. Nitish, you took the initiative. Thanks to you. God bless you. And I wish everybody to be fit, fine, safe, and increase your immunity to fight. We will overcome it. I'm sure about it.
Thank you so much. And my
God bless.
apologies to the viewers whose question we will not able to take it today, but I'm sure we will have a lot of sessions like that. We will include topics which has been suggested and which has come up during the chat box today. So look forward to seeing all of you again. Once again, thank you so much. And to keep yourself updated, kindly log on to our Facebook page or Twitter handle so that you keep getting information of such sessions. Thank you so much. I think you were saying something.
Thank you. Thank you, everybody. God bless you all.
Thank you. Don't forget to like us on our Facebook and Twitter so that you get information about various activities organized by Rishihood University in future. Thank you so much. Have a good day. Stay safe, stay healthy, stay active while you are at home.
God bless. Bye-bye.
Bye-bye.